As you all know, the International Forum for Promoting Homeopathy is regularly conducting a webinar since last 1,302 days. And today we have a guest in Dr. GURUKIRAN from Karnataka. Dr. GURUKIRAN has completed his BHMS, and then he undertook another course, SCPH, from International Center for Homeopathic Medicine, United Nations. He's in postgraduate fellowship, and he has presented so many beautiful presentations in this forum in earlier, some of the earlier editions of our webinar. And he has very good knowledge in homeopathy, and he has recently published an article, a research article, in the website of our National Institute of Homeopathy. And as you all know, the research, this kind of research work is very, very important as far as homeopathy is concerned. And he, almost all his presentations have the quality of a research paper. So I don't spending more time on that. He has presented various subjects: psoriasis, thyroid problems, PCOS, epilepsy, hypertension, respiratory tract disorders, and so many in different various seminars. And today, Dr. GURUKIRAN will be presenting an autoimmune thyroid and homeopathy perspective. This is a big subject, and let us welcome our beloved guest, Dr. GURUKIRAN. Welcome.
Thank you, sir. Thank you for the warm welcome again. I'm happy to be here again in the IFPH platform. Yes. Good evening and good morning to some of the doctors, and happy Holi.
Happy Holi.
Okay. I'll share the screen. Is it visible, sir? Screen?
It's visible.
Yes. Right. Fine. Yes, the today's session is about autoimmune thyroid diseases and its homeopathic perspective. It's a big topic, autoimmune thyroid. Day to day in our clinical practices, we are encountering a lot of thyroid cases, and we should able to treat the autoimmune thyroid cases also. Before that, we should able to diagnose the case of autoimmune thyroid. So what are all the factors? How can be diagnosed in our daily practice? Let me see. Let us talk in the today's session. Before going forward, I would like to seek blessings from the Master, Dr. Samuel Hahnemann. Yes, and I would like to dedicate this session to all my teachers where I have learned homeopathy. This is Dr. Sharadamma. Actually, she passed away last year at the age of 84. So I started my career during my BHMS days in her clinic by observing how she treats the patient, how she converses with the patients, how to pack the medicines, how to dispense the medicines. All the things I have learned from this very young, very old and dynamic lady. And Dr. Jayalakshmi was taught me well. Dr. Praful Vijaykar have learned so many things. Dr. Vijay Krishna sir, and I have learned all the things of presentations from him. And Dr. Manohar sir, he is practicing in Mysore. Yes, I dedicate this session to all my teachers. Yes, objectives for today's session. To know about autoimmune thyroid diseases. and the factors involving it, and the types of autoimmune diseases where we encounter in our daily practice, and the approach towards it, how to treat those cases in our clinic. Lastly, the homeopathic treatment part. So these are the objectives for the today's session. And if I make an attempt by showing you all those types of autoimmune diseases, what are the factors involving it, and approach towards it, and the homeopathic treatment part, and my session will be done today. So by the end of this session, you should be able to know what are all the causes, how can we diagnose the autoimmune thyroid cases, and approach, how can we approach these cases in our clinic, and the treatment part. If you get something out of this, and I'll be happy by the end of the session. Yes. So thyroid diseases are amongst the most prevalent antibody-mediated autoimmune diseases and are associated with other organ-specific autoimmunity. So autoantibodies may produce inflammation and destruction of thyroid tissue, resulting in hyperthyroidism, goiter in Hashimoto's disease, sometimes even transient thyrotoxicosis, or they may stimulate the TSH receptors to cause thyrotoxicosis. Next, autoimmune thyroid diseases include Graves' disease and Hashimoto's thyroiditis, among others. Hashimoto's thyroiditis and Graves' disease are the major causes of hypothyroidism and hyperthyroidism, respectively. That we know that Hashimoto's thyroid diseases relate to hypothyroidism, Graves' disease relate to hyperthyroidism. So, autoimmune thyroid diseases reflect the loss of immunological tolerance and share the presence of cell and humoral immune response against antigens from the thyroid gland, with reactive infiltration of T cells and B cells, autoantibody generation, and subsequently the development of clinical manifestations. So what are the environmental factors involving autoimmune thyroid diseases? As we all know this, low birth weight. When a baby born with a very low birth weight, that may influence to have this autoimmune thyroid disease in the future. Iodine excess. Oh, where can we know this? Where can we get this iodine excess? Can anybody type it in the chat box? It's a daily activity, what we do in our lifestyle. Where do we have iodine excess? Where can we have it? Can anybody chat it in the type box? Sorry, type it in the chat box. Where can we get iodine excess that we use in our daily life? From the salt, common salt. So what was the criteria long back when they added iodine into the salt? Can anybody? Whatever you know, can just type it in the chat box. What was the criteria when they added iodine in the salt long before? It was a condition where the people was facing iodine deficiency. On the basis of that, everyone should have iodine in their diet. So they added iodine to the common salt. So what's happening now? It's becoming iodine excess. Next environmental factor is selenium deficiency. So selenium is very, very important element in thyroid function. So when there is a deficiency in the selenium, the thyroid function gets altered. Then you may have the position to have thyroid diseases when there is a selenium deficiency. So it is one of the important environmental factors. And use of anovulatories. What is anovulatories? Can anybody? Anovulatories, especially the females. Any answers in the chat box? Anovulatories. It is the hormone pills. What they use for the imbalance of periodic cycles, especially menstrual cycles. The use of anovulatories. This may lead to thyroid diseases. Recently, I'm treating a case of especially autoimmune thyroid. There is a strong history of use of anovulatories because long back, when the patient got conceived for the first time, the baby's heartbeat was not proper. At that time, the doctor advised for MTP. For that, they have prescribed some hormonal pills so that it will induce the uterine contraction, so to expel out the fetus. So she has used twice in her lifetime. From that, now she is prone to this autoimmune thyroid disease. So we should be very careful in asking the history of the patient when you get an autoimmune thyroid diseases. These are all the factors you have to stress upon to the patient and get the history properly, especially use of anovulatories. Also that, and also another factor is once they start using this postponed tablets or rescheduling tablets, you should be very cautious. We have to ask the question of use of any anovulatories. It may be one of the cause of thyroid diseases. And parity. What is meant by parity? It is equality, where women's face or women's fight for the equality with the men. They go into stress. They create their artificial pressures upon them. This may lead to autoimmune thyroid diseases. So you should be very careful by asking these questions. And stress, as usual, we know that stress is one of the major cause. And smoking. Allergies, long-term chronic allergies, should be very cautious while taking the case. And radiation exposure, especially in the paramedical staff and in the lab technicians, where they're exposed to the radiations. You should be asking these things. And viral or bacterial infections. Repeated viral or bacterial infections may lead to these kind of conditions. And fetal microchimerism. What is this fetal microchimerism? Anybody who can say? Please type it in the chat box. What is fetal microchimerism? Anybody who wants to say? Or shall I move on? Fetal microchimerism is low level of fetal cells in the maternal blood or in the tissues during the pregnancy or after the pregnancy. This may lead to autoimmune thyroid diseases. This is where there is an increase in thyroid levels during the gestation period. Then it may continue after that also. Then we should be cautious to ask this question, fetal microchimerism. They may not know, the patients may not know about this, but we should be cautious while asking if there is a thyroid raise in your gestation period. Then we can correlate with this fetal microchimerism. Shall I want to repeat again? Fetal microchimerism. It is the low level of fetal cells in the maternal blood and in the tissues during and after pregnancy. Okay, that is called as fetal microchimerism. So these are all the very, very important environmental factors. When we take up the case of autoimmune thyroid disease, we should be able to elicit these kind of questions. Okay. Then, although it is essential for normal thyroid function, iodine is one of the most important precipitants of thyroid dysfunction. This I have said again in the iodine excess, where we use the common salt, which is having lot of iodine. It is very essential. That is why they have added in the common salt long before. But nowadays, it is one of the most important precipitants of thyroid dysfunction. We should be very cautious by using the common salt, which is iodine added. Thus, while mild iodine deficiency is associated with the lower prevalence of Hashimoto's thyroid, excessive intake is associated with the higher prevalence. So what is the inference from this is we can avoid lot of iodine added salt in our diet. Then we can shift to pink salt, where the iodine is very, very low in quantity. Higher titers of thyroid autoantibodies were found in 19% of patients receiving iodine. See this. After iodine was withdrawn, antibodies levels decreased significantly, and after a 4-year follow-up, these levels had normalized in 4 out of 6 patients, in 66% of the cases. So this only shows that how important the iodine is, and also how it can cause the thyroid diseases in our daily routine diet. So we should be able to use the salt very cautiously, or you can shift to pink salt or the rock salt or the Himalayan salt, whatever they cause, or senda namak. And radiation exposure. Radiation is perhaps the best characterized environmental exposure linked to effects on the thyroid. The most common thyroid manifestation of radiation is hyperfunction due to direct destruction of the gland, but stimulation of thyroid autoantibodies may be another mechanism for both hypothyroidism and hyperthyroidism. Stress. As usual, I said stress is one of the major factor in our lifestyle. Various types of stress had been linked to Graves' disease. The postulated mechanisms include induction of immune suppression by non-antigen specific mechanisms, perhaps due to the effects of cortisol or corticotropin releasing hormone on immune cells, followed by immune hyperactivity leading to autoimmune thyroid diseases. So this is one of the very, very important and major factors. Autoantibodies. So what are all the autoantibodies that can be present in the body? Again, this is the anti-TPO. What is this? Anti-thyroid peroxidase antibody and anti-thyroid globulin antibody are the most common thyroid autoantibodies present in the patients. So when you have a doubt in the mind that this patient may have autoimmune thyroid, please, you should be able to write an investigation of ATPO and ATG. That is anti-thyroid peroxidase antibody and anti-thyroid globulin antibody. So this is the test you have to write to the patients where there is a doubt of autoimmune thyroid disease. So this is the most common thyroid antibodies present in the patients. In fact, the absence of these autoantibodies could exclude a diagnosis of autoimmune thyroid disease. So you should be very cautious. If you want to rule out there is no autoimmune thyroid disease, then you should send a patient for the investigation of ATPO, ATG. If the test comes in a normal level, if the value comes in a normal level, then we can exclude a diagnosis of autoimmune thyroid disease. Then it may be in a subclinical level. Then the thyroid level will be in subclinical. So we can treat it very easily. If there is a positive report of ATPO and ATG, then it is a clear-cut case of autoimmune thyroid disease. According to the mathematic chart, Dr. Praful Vijaykar has given this chart. The autoimmune diseases comes to the highest level, that is in the 7th layer of the cell. Mentioned it in the corner, 7th layer of the cell, which is under psychosis. The mathematic approach towards all the cases, psychosis, autoimmune diseases. It comes under this. So the disease progress always towards to be rightwards. The cure progress will be leftwards. When you read this mathematic charts application towards it, then you'll come to know what can we expect in these kind of autoimmune thyroid diseases. Let's move on to the case now. I think I made it an attempt to give you some background of autoimmune thyroid diseases. Having those things, let's move on to the case. If there is any queries, I'll ask you in the last session. This is a case of autoimmune thyroid where the patient aged 43 years was presented with the throat pain and increase in weight since 6 months and having very long-term constipation, very chronic, since 10 years, 12 years. She was not knowing about these things. So, on the basis of this, I sent her for an investigation. See the report. T3, T4, TSH, all have been increased. See the TSH value is around 100. So next thing what I did was, after seeing this report, and I have a doubt that she is definitely having some autoimmune thyroid. So I sent her to another investigation to know whether it is autoimmune or not. It is ATPO and ATG. See in this report, see the ATPO report is greater than 1000. Where it should be less than 5.6, it is 1000. And ATG is 849.4, which should be less than 4.1. This was the report. By this, we can clearly say that this is a case of autoimmune thyroid disease. So, what to do now? We have diagnosed the case that it is autoimmune thyroid. What to do? How can we progress in this case? Can we send it to the higher center? Or can we treat this? Please type it in the chat box. What can be done? Can we treat this autoimmune thyroid disease on homeopathy where there is ATPO values are greater than 1000, ATG values are greater than 800? Can we treat in homeopathy? Or we should send them to take some antithyroid drugs with lifelong treatment? What can be done? Yes. Okay, good. Yes, after this, I asked the patient about her life space investigations. I probed into it. This is very, very important in each and every autoimmune thyroid cases. I have taken up a gist here. I'm not going to very in detail the session because of the time limit. So the patient had brought up in poverty with lot of abuse in the childhood, and that she got married. After her marriage, the husband is a drunkard. He used to dominate all the time. So what would be the condition of the patient? From the childhood, she is brought up in poverty with lot of abuse. Now, after getting married, husband is drunkard and used to dominate all the time. So what can a lady do in this situation? From all the situations, the patient thought of suicide. The patient attempted also for hanging twice, but she has been rescued by the neighbors and relatives. So this is the life space investigations. So what can be done next? Anything we get it from this case? Any inputs? Give importance to mental plane. Okay. Then what else? Whatever you think, you can type it so that it will be a very good interactive session. Suicidal thoughts. Good. So how can we proceed after this? There is a history of suicidal attempt, trauma of the patient, suicidal disposition. Very good. Suicidal disposition. Good. Yes. After this, we have to select the rubrics. What are all the rubrics? Ailment from abuse or domination. It is there. Definitely it is there in the case. And there is suicidal disposition. The patient has attempted twice for the suicide. Third one is ailment from abuse in childhood. She has faced lot of abuse. The thyroid may started, this disease may started long back, but she came to know at this point of time after getting investigated. Otherwise, she may not knowing and she would have ended up in some trouble, big trouble. So we should be able to diagnose these kind of cases quickly, autoimmune thyroid diseases. Otherwise, it may take time. Lot of patients come to my clinic having lot of TSH imbalances after taking so much of medicines from 8 years, 10 years, 12 years. They would have not gone for investigations for ATPO and ATG. Lot of cases I face in my daily practice. If they ask why, they say, sir, we don't know about this test and doctors have not advised for this test. The endocrinologist also, I have seen cases in my clinic, they will be not testing this ATPO, ATG. I don't know why. I don't know why. After getting tested with ATPO, ATG, the values will be very high, very, very high. So that by the time they have progressed deeply, they would have tested long back ago. Especially this case, what I'm showing is, which has been tested within no time, very quickly have sent it for investigations. They got the report. Let's see what has happened now. After converting this into rubrics, next step is repertorization. See, what is the repertory? Abuse ailments from domination, suicidal disposition, again, abuse ailments from childhood. So what is the remedy which is outstanding? Carcinosin, Thuja, Staphysagrilla, carcinosin and Thuja. In that totality which covers the highest mark is carcinosin. So after repertorizing this case, prescription was carcinosin 1 ml, single dose. So I have given monthly 1 dose carcinosin. Follow. After a few months, the patient started to get better. Constipation has reduced. So once the constipation has reduced, the patient is passing the motion clearly, daily. So what is the inference now? What is the progress now? Are we heading towards a right direction or wrong direction? Once the generals get better, please chat it in. Please type it in chat box so that I come to know, is it right or wrong? Once the generals, physical generals gets better after your prescription, that shows that we are heading in the right direction. The weight has reduced to 2 kgs. The patient became active throughout the day. Once she got to know about this, then she was saying that, sir, I would not know that I was very lethargic in the past. After getting your treatment, now I feel that I'm very active whole day, so that I can work properly, I can sleep properly, I can go to the stools properly. So this was the change, and the sleep got better without any tensions or without any stress. She used to sleep sound. Yes. Okay. Next, after 3 months, I have sent for investigations. See the report. TSH came down to normal, 1.18, T3 1.68, T4 not 1.51. Absolutely normal. See the hemoglobin level. We should be very careful that hemoglobin should not drop after your treatment. I think basically in the last report, I think I didn't show the hemoglobin. It was 9 grams, 9 to 10 grams, I think 9.8 or 9.6 something. Now it has raised to 11.3 after the prescription. T3, T4, TSH is absolutely normal. Within 3 months' time, if it is diagnosed properly in an early time, very quickly. Again, I have repeated 1 dose of carcinosin 1 month, 1 1 dose. After 5 months, the report shows again normal. It is 2.9, 1.74. T4 is 134.67. So, what can be done after seeing these reports? Can anybody please type it in the chat box? What can be done after seeing these reports? Shall we continue the treatment or shall we discontinue the treatment? What can be done? Just in 5 months, this report. Wait and watch. Good. What they do in the allopathic fraternity? If they, after prescription, if they see the reports like this, what will they say? They say they want to continue. Yes, definitely. Please continue the treatment. Please continue the whatever it is, altroxythyronam tablets. Yes, this is where homeopathy stands tall. This is where homeopathy has the potential. After seeing these reports, without any hesitation, I stopped the treatment. The treatment was stopped by seeing the improvement. Yes, no treatment for some more days. After a year, the patient came for the checkup and I have sent her for ATPO investigation. See now the value of ATPO, it has come down very largely, very drastically. It was greater than 1000. Now it has come down to 173.3. And the ATG report, 9.76. I'm sure within few months' time, it will get normal. I'm not treating this case now. I have stopped all the medications. The patient is doing well because it takes time. And one point we should be alert in treating this autoimmune thyroid cases. After you treat ATG, this anti-thyroid globulin antibody should come down first, not the ATPO. You should be very cautious. If ATPO comes down first and ATG rises, then you are heading in a wrong direction. Please retake the case or review the case again. We have to change the prescription. In any case of autoimmune thyroid diseases, after starting with homeopathic treatment, ATG should come down first. The value also, ATG should come down when compared to ATPO. When compared to ATPO, ATG is very less. Definitely in few months' time, it will get normal without anything. This is the potential of right homeopathic treatment. Yes. Let's move on to the second case now. This is also a female. Age around 37 years. Known case of hypothyroid, was presented with weakness, body ache, falling of hair, and skin dryness since 2 years. She was taking some Thyronorm tablets. The patient was under Thyronorm since 2 years. When this patient came to me, she was not diagnosed with autoimmune thyroid disease. She was taking blindly this Thyronorm tablet since 2 years, and the TSH values would fluctuate up and down, up and down. When the TSH value gets up, they change the mg of tablet. If it was 75 mg, then they would have prescribed 100 mg, 125 mg, then 150 mg, like that. Once it gets down very low of TSH value, then you would have changed to 100 mg. That's what they are doing. But there were no right and stagnant MCG for Thyronorm. She was having these kind of troubles. So after seeing the report, this was the first report when she came to me. After taking Thyronorm tablets for 2 years, the TSH was not normal. It was 13.05. Then I have sent her for ATP-ATG report. In this case, the patient failed to provide me this first report. Actually, I have an entry in the case sheet. It was ATP is 580, ATG was 180. This was the first ATP-ATG report of her. All other reports are there with me apart from this. After seeing this ATP-ATG, let us study the mind of the patient. The patient was oversensitive, irritable, and quarrelsome, and having weeping tendency. Every time when she gets into quarrel, every time when she weeps, consolation was the only thing which was ameliorated. 3 marks. Consolation, amelioration. By this, we would have come to the remedy. Can anybody say this? What could be the remedy? By saying this, good. Dr. Veena says pulsatilla. An autoimmune thyroid case can be treated with pulsatilla, a simple remedy like pulsatilla. Yes. All are saying pulsatilla. My query is, can an autoimmune thyroid disease can be treated with a simple remedy like pulsatilla? Yes or no? Yes, Dr. Rasina Mohammed says yes. Definitely yes. Can. Yes. Beautiful answers. Beautiful answers. So how can we confirm this? Please convert it into rubrics. Patient is oversensitive. The patient having weeping tendency. The patient is irritable and quarrelsome. Last but not the least, very important rubric is consolation, amelioration. This was the totality of the case. Let us confirm with the repertory chart. Patient was oversensitive, weeping, tearful mood, consolation, amelioration, quarrelsome. So what is the remedy which is outstanding? Pulsatilla. Can we go with the pulsatilla? With the autoimmune thyroid disease? Yes, the prescription was this. Pulsatilla 200, single dose for 15 days. I have repeated once in a month or twice in a month. After 6 months of pulsatilla, patient have done this test. It is TSH was 4.9. Starting it was 13 point something. Now it has came down to 4.9. Are we heading in the right direction now? Then it was not so encouraging because just 4.9 it was. It should have come down to normal level within 3 TSH value. So I shifted the prescription to pulsatilla 200 to 1 m, 2 doses in a month. After 6 months, see the report now. Hemoglobin in the last report, I have again forgot to show. The hemoglobin was 8.3 something. It has raised to 9.7 now. TSH was 3.8. Now, what can be done? After a year, I have sent it for test. See the report now. In this, what it has reduced first? ATG. ATG was 180 something in the first report. Now it is absolutely normal, which is within 4, that is 1.6. ATPO is, it was 580 in the first report, now it has come down to 454. It is started to reduce. So we are heading in a right direction. Okay. Then, so pulsatilla 10 m, single dose in a month. For 3 months I have given her. After seeing this report, it is confirmed that it's a case of pulsatilla. So pulsatilla 10 m, because mind has involved in the case. Pulsatilla 10 m. Some may respond to 1 m, some may have to give 10 m or more. So after a year, see the again ATG report is 0.4. It's absolutely normal. See the ATPO report 226. Further it has reduced. So what can be done after seeing this? So after seeing this, I have given her a dose of 50 m, pulsatilla 50 m one time. After 3 to 4 months, I have given pulsatilla CM one dose. The treatment was stopped after giving CM. Absolutely no treatment. Few years later, I have sent her for a test. See the report? Absolutely normal, 0.2. Definitely, I'm sure that ATPO is, again, it has reduced to 88. Definitely, I'm sure that it will come to normal by this time. So this is the potential of right homeopathic treatment. Whatever may be the remedy, we have to prescribe properly according to the case, according to the totality, by confirming it through repertorial chart.
Yes.
So, thank you. Thank you, one and all, for this wonderful session today of autoimmune thyroid diseases. I hope it has served your questions, queries, and approach towards autoimmune thyroid diseases.
Definitely, no doubt about that. No doubt about your potential. And this is a fitting reply to those who are still doubtful of the efficacy of homeopathy after 200 years. But always, even those who are occupying the higher positions, often telling, if any man was there, he should have rewrite this organ of medicine. But this is a very much compiled and composed one. Time for discussion. Those who would like to participate can go to the participant list and raise your hand. But why you said about this ATG should come first down? That's a
Yes, sir.
yes.
It is a marker.
Pardon?
It is a marker. It is a marker of autoimmune thyroid.
Yeah.
Especially it's a thyroid globulin. So that is why it should come down first.
Yes.
Once your remedy is right, ATG should come first, then ATPO.
Okay. Now Dr. Jayalalitha raised hand. Dr. Jayalalitha. Actively participated in the discussion. Dr. Jayalalitha, please.
Doctor, it was excellent session. I want to know about how we can stop or discontinue the allopathic medicine like electroxin or Tyronol when the patient is taking for several years. How we can stop this medicine or discontinue with our medicine?
Very good question. It's a daily problem in our clinics. See, once if the patient have started this Thyronorm or Eltroxin in a very short period of time, once you start with the medicine, once you get the physical generals better in a patient after the homeopathic prescription, then we should able to stop those medicines immediately within a short period of time. If in a chronic conditions where the patient was taking Eltroxin, Thyronorm since many long years, for 10 years, 15 years, then we should start our treatment parallelly along with the medications, all those things, and 3 months after, 6 months after, 1 year later, by seeing the reports, by seeing the physical generals, then we should be able to stop those medicines at one point of time. Then we should continue our medicines for some more days. After seeing those reports, then we should stop all the medications. This should be the criteria.
Okay.
Thank you, Doctor.
Now, Dr. Sanesh.
Yes, yes, as usual, Dr. Gurukiran, you really made a beautiful presentation on this holiday. Really, thyroid diseases are very important as far as homeopathic doctors are concerned, and we used to get all those cases. But the difference between there and here is that most of the people come with all records. Sometimes they, because whenever they get a problem, they used to consult the ENT surgeon, and then they go to the thyroid specialist, and then they do all the tests and give some thyroxine or thyronum, whatever may be, some 100, 200 milligram. And that is the condition when people used to come to our clinic. Then what we have to do, what we used to do is, they believe that, oh, doctor, our thyroid TSH is normal after taking this medicine, so we are continuing the medicine. Then what I used to tell them is that you just stop the medicine for 5 days or 7 days, and then you check again. Then you can see what is the present condition. Actually, in those otherwise, they may say after taking our medicine, doctor, the TSH is very, very high after taking your medicine. When I was taking the other system of medicine, it was normal. So this is what we used to do in our clinic, and this is how we have to check the thyroid problem, because we will have to show them that your thyroid TSH is not at all normal, but it is being hidden by the medicine you are taking for this thyroid. So this is one thing I would like to. Anyway, the cases were excellent, and your mode of presentation and mode of giving medicine and everything is excellent. Congrats once again. Hope we can have another session with some more cases, because case study is more relevant as far as our doctors, as well as we used to publish it in the YouTube. Then some people, if some people watch us this, they will definitely know that homeopathic doctors can do this much of things with homeopathic medicine.
Yes, sir.
Okay.
Because one thing, sir, because if I see a lot of patients where they have not diagnosed these autoimmune thyroid diseases with ATP or ATG. Simply they used to prescribe Thyronorm, Eltroxin for very many years. The patient used to take a lot of things. Then if they come to us, then I suspect a case of autoimmune thyroid, then I write an investigation. Sir, what is this test? It is showing so much. The ATP was greater than 1000, sir, and I'm getting tension now, sir. So can we solve this case? Can we treat this case? It is so high that I would get cured or not. I'm in a doubt, sir. They'll come to like that. No doctors have advised me to test this ATP or ATG, and you have advised me for this test. After this, I came to know about this. They all say these kind of things. Yes, it is. It is situation is like that.
Maybe due to they don't have enough tools to combat the situation. That is why they are ignoring that.
Yes, definitely. That is the point, sir. They don't have any weapons to combat this. So that's why they don't want to test these kind of things.
Yes.
If they're going to test this, they will be exposed.
Just like the RT-PCR test, they stopped when after taking the vaccines, the people are getting more and more infected. So they deliberately stopped the medicine. This vaccine, this test, RT-PCR, then declared COVID is no more. That is a methodology they are adopting. There is a question in the chat box.
Yes, sir. What is that?
By Dr. Do you supplement treatment with thyroidinum 3x, 6x? That's another question.
No, 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 no.
No,
I'm
no,
not.
no.
I'm not using the trituration of thyroidinum 6x or 3x. I may give thyroidinum 30 in where there is a paucity of symptoms in the progress. I have used thyroidinum 30.
Once you are get the remedy, then there is no doubt about that.
Yes.
Usually what I do is that whenever the patient come with the medicine of 200 milligram or 100 milligram, then in those conditions, when I just give them thyroid 3x or 6x in the beginning stage, so that as you pointed out that when the patient is feeling better and better, then we gradually reduce it to half. For example, in the what I do is to just give the 3 grain tablet of 2 in the morning as well as evening, and then it may continue for 1 or 2 months. Then it may reduce to one and 1. Then gradually it is 1. Then I totally relieve. Continue with the constitutional medicine. This is what we used to do. I don't know whether it is right or not, but we have to complement because the patient is saying that, doctor, we are taking this much of medicine, thyroid now. For example, I still remember a case of a lady who was taking this more than 200 milligrams of their medicine, but still the patient cannot hold the hand more than this. When I asked them to do some exercise, then after giving homeopathic medicine, I just reduced the medicine to 100 milligrams. First I stopped, but the thing was that she is having severe pain thereafter. So I just asked her to continue with the 100 milligram and homeopathic medicine. And later she can hold hands very perfectly like this. And so this is how we have to manage it. We have to use our common sense also. We need to ask this kind of patients to go exercise because most of the people may develop arthritis after taking this much of steroid medicine. Am I right?
Yes. And we should remember that if the case comes early to the homeopathic treatment, as I showed in the first case, without any interruption with the thyroxine, L-troxine, thyronam, something like that, the cases recover very fast.
Definitely.
The cure is very fast. If they come after taking all those things, they come to know this autoimmune thyroid disease after 5 years, 3 years, 10 years, then it will take time.
Definitely. I still remember a case of a patient who has having more than 100 TSH level was more than 100. But she never took any allopathic medicine before that. So with our homeopathic medicine, lacasis, it was totally cured after 1.5 years. Even I have stopped every medicine, and after some 3 years back, now she is having 1.1 only.
Yes.
So that's the beauty. The main symptom of the patient was whenever she she start up during sleep because of suffocation in the throat. So I just asked her to test all those things, and then what we noted was there's a very high level of there was high level of thyroid as well as these thyroid level was more than 100.
Okay, Dr. Okay, Dr. Ganesh. Now, Dr. Ram Pravesh. Dr. Ram Pravesh. Yes.
Thank you, Manoj ji, and thank you, Dr. GURUKIRAN ji. Very nice presentation, dynamic lecture, autoimmune disease, thyroid. But according to law of homeopathic science, main cause of disease dynamic. Anger, fear, abuse. But medicine is also selection dynamic. Thyroidinum 30, 200. Dynamic according to miasmatic, treatment according to miasmatic, autoimmune disease. The thyroid is a psychotic miasm,
Yes.
thuja, etc. According to holistic treatment, single remedy. But you are very select in single remedy carcinogen and pulsatilla. Nice, excellent session.
Thank you, sir.
Thyroid. Thank you. Very thanks.
Yes, okay, Dr. Amrosha. Of course, the medicines are there, but remedy is only one. So we must always say about this single medicine, but remedy, not single remedy. I think that's the most suitable word. Now, may I invite Dr. Veena to have some words as well as a vote of thanks to our GURUKIRAN doctor. Dr. Veena, are you there? Dr. Veena. Yes. Another talented young person of the IFPH, Dr. Veena.
Thank you for the kind words, sir. Dr. Gurukiran, as always, has made a very good presentation. So it's highly encouraging for budding homeopaths to see the scientific evident results after homeopathic treatment. Hats off to you, sir, and thanks for sharing your knowledge in this platform.
Thank you.
Thank you so much.
Yes.
Thank you.
During the session, Dr. GURUKIRAN hinted about the factors that are activating this thyroid disease. That's also very important. The exciting cause, maintaining cause. That's also very important. Before going to the other aspects, we must also focus on all these things, the environmental factors, especially the use of this iodized salt. Very exactly, that is the most important thing. What they are reaping, and always with some sort of theories, they always emerges with iodized salt, and almost all persons took this iodized salt and got the result.
Yes.
The thyroid diseases. I think around 20 to 30% of persons, especially ladies, they're affected with these thyroid diseases. Then you said about the deficiency, the low birth weight babies. Well, all these comes together, it will become a major threat. I think somebody must, like you have the ability to do all these things wonderfully, magically. You must convert to a specialist so that homeopathy can improve a lot. We need specialists at this turn, not general physicians. Nobody requires them. Definitely, and we need certain courses to study all these things comprehensively, as well as needs publications. Definitely, that will improve homeopathy a lot. With a remark, let me conclude today's English edition. Hope that we will meet tomorrow. Till then, goodbye.